It's all about working hard. I can tell you, I'm not the smartest, but it's hard to outwork me. When I first made the newspaper with this guy that I operate on, and I said I use the endoscope and laser to operate him awake, the chairman of Mayo Clinic at that time in Scottsdale said, "You can't do what you say you do. Picking up Camben's technique, stay inside the disc." I developed the YES procedure, which is the inside out technique. But in reality, you shouldn't be just inside out or outside in. It should be a combination of everything. And you should be able to operate on your patient awake. It depends on the individual. You can't say this is my area. I think in the future is going to be whoever can do it and guarantee the result. Kai, I'm on a broadcast. I'll call you back. Okay.
Today, I'm honored to have a spine surgeon legend join me. Super excited. He needs no introduction. A visionary and one of the first innovators in endoscopic spine surgery, outpatient spine surgery, the first surgeon to ever use lasers through an endoscope. You've authored over 170 scientific articles, and the inventor of the Yeung Endoscopic Spine System, Dr. Anthony Yeung. Thank you for joining me today.
Thank you for having me, Mike.
Yeah,
I've
absolutely.
known you for quite a while.
Yeah.
But there's some history that a lot of people may not know because I go back all the way to the early 2000s.
Yeah, and that's
1993 actually.
Really excited to talk to you, and I want to go back. So why don't you start by telling us your story? How did you get interested in medicine, and how did you get interested in spine surgery?
Okay. I was the oldest of the Yeung family. My father represented China in the Olympics, and he was with the KMT, Kuomintang. This is the nationalist government in China. When the Civil War broke out, the communists took over, came in from the West with Mao Zedong. And so luckily, my mother was born in Portland, Oregon. And she, at that time, I could have US citizenship because of the law that says people born between certain ages can be a citizen. So I came in as a naturalized citizen because I was born from a American-born woman. And she got her start because her grandfather came over to the US looking for riches when he was 16 years old. And he was referred to a family friend in Portland, Oregon. And he was such a good worker that the friend says, "You should go to Alaska to make your fortune in the summer and come back in the winter, and then you can work for me." So that's how she got started. And when the war broke out, she then took us to Arizona because her sisters were in Tucson, Arizona, and her brother was also in Arizona. So we got our start by, I was 7 or 8 years old. And we moved in to my mother's sister's house. She was just married. And can you imagine 3 kids just joining the family? And so I worked since I was age 10 at my uncle's grocery store called Eagle Market. And he was a veteran in World War II in the US Navy. See, so that's how we got started. Then my mother decided there's no future for the Yeungs in China because it's now communist. We're nationalists, strong patriots. So he says, "I'm going to have to stop talking in Chinese with you and just speak English because I need you to turn it around in 1 generation." 1 generation means I can't go start with a grocery store or a restaurant and have my kids then go to college. I want to make it in 1 generation. So that means the boys have to get MD, PhD, and the girls have to get advanced degrees, at least masters. So I said, okay, I did that. And it was my mother that inspired me coming here because I saw how hard she worked. She was brilliant. She was beautiful. And she actually was educated in Beijing when Puyi, the last emperor, was there. So she got to know all the people who were part of the revolution, like Chou En-lai. She went to school, the same school. With that, she went to a Christian school. So that's how I got my start. And I can tell you, I still remember how I got started. It's because of my mother. My father didn't raise me. My mother did. He didn't come over until I was in high school.
Wow.
But he was a big shot, Olympic swimmer representing China. He was one of those whiz kids.
Yeah.
But there was also no future for him in China. He stayed in Hong Kong and sent us antiques that was from the family temple. So we had Ming Dynasty things. We were like gumps, okay?
Yeah.
But we were selling it for nothing. And some of the people that realized what we had, they came until they bought up our whole supply. But our biggest seller was these little salted plums called salalitos. So we opened a store in South Tucson, and for 5 cents, we would sell by the hundreds of the crates. And that's how we got through school. But in order to make it, we couldn't afford anything. We were very poor. So he says, well, you have to study hard to get scholarships and use the U.S. system that awards people who work hard and are smart to get scholarships. So that's what I was focused on.
Wow. So high school in Tucson?
High school in Tucson. I went to inner city school, Tucson High. At that time, it was only Tucson High and Phoenix Union. But Tucson High, we had a class of 2,500 that we can just start splitting off different sections until when I graduated, it was 646.
And then where'd you go to college and medical school?
I went to University of Arizona. I
UA.
actually had a Baird scholarship, which is for chemical engineering. Both everything. And I went and toured the College of Mines. I said, I don't want to be a College of Mines. I want to be a physician, because when I came to Tucson, a doctor named Dr. Jack Klein, ENT doctor, took us under his wing and gave us hospital beds, things like that. I said, okay, I want to be like him. So now his son is a colorectal surgeon. His grandson is an orthopedic surgeon, and they're still in Tucson. But he advised his own children, it's too hard to get ahead in medicine because, you're there to do good for people, but you're not going to make a lot of money. But I said, you know what? I don't want to be poor all my life. So I want to work hard and benefit from that. So that was my mantra. Work hard, be better than everybody else that you compete with, and take advantage of the system that we have in the United States, where all the immigrants who come here can work hard and make it.
Yeah, and it's crazy. I think, it's 2022. I have 4 young kids, and I think a lot of the younger generation doesn't really realize how great we have it in the United States, and you've experienced it. You went through all of it, right?
Yeah, for all the politicians who are so focused on power so they can have votes, that's the wrong way. The reason the United States is great because all the people who didn't have a role came here and they worked hard and got ahead. Some became gangsters, but they did it in their own way. But once they make enough money, as gangster prohibition, they become the people who are going to, you can't die with all the money, right?
Mm-hmm.
So you become philanthropists, like the Kennedys,
Yeah.
And like maybe even like some of the oligarchs in Russia, they want to maintain their power. But it's all about power. But Chinese philosophy, would you rather have money, power, or both? The answer is both.
Yeah.
And so you can't do it by just inheriting and being a trust fund baby. You have to work hard for it.
Yeah.
And that's what this country stands for. The people who can work hard. And I watched you as well, because you come by and now you became very successful because you understand, because you have some products that I think it's going to benefit the population, such as I see you're a representative for Optimesh. Well, I helped start Optimesh because it was very easy to do a fusion in a very short period of time, but you had to come up with different techniques and different implants to put in so that you can get a fusion in a method that none of the surgeons really understand or know how to do.
Yeah. And yeah, I'd love to get into spine surgery. We'll talk about that here in a minute. One thing that just is going through my mind, talking about hard work and really in the United States, if you work hard, the likelihood of you succeeding is high. But I see a lot of times where, people that have had that level of success, their kids end up, kind of riding their coattails, and sometimes their kids don't turn out as great. But that isn't the case with you, because obviously your son became, Chris Yeung became a very well respected and well known spine surgeon. And so I guess one thing I have a question: how were you able to maintain sort of that work ethic and drive in your kids after you had become so successful?
I hope that what inspired me would inspire them. Now, my son wasn't even thinking of spine surgery, but he actually didn't pick medicine until he was in college. Then he decided he liked it, and he liked sports and sports medicine. So he had some sports background, probably because of my father. So he was not an all-star, but he worked hard. He was a Brophy tennis team, and so he realized that in order to get ahead, you help your children do what they like and concentrate and do it as best that they can and try to be the best at it. So now my children did the same thing, and my grandchildren did the same thing. They're all taken care of.
Mm-hmm.
So now my wife is deciding, hey, I worked hard next to you. I deserve some of what you have.
No, it's remarkable. And just going back to your mom, just how she inspired you, and you really made that generational shift for your family, the Young family. So she was obviously an inspiration to you, Dr. Klein, I think you said it was.
Yeah, Jack Klein from Tucson.
And you've been a mentor and an inspiration to so many people, so many surgeons. Maybe who were some other mentors for you early on in medicine?
All right. I think I patterned what I wanted to do in life after Dr. Jack Klein from Tucson. The other, it wasn't known until after I was in college and then in medical school. I think I was noticed because when I was in medicine, I was an intern at Good Samaritan Hospital. And the doctors there that inspired me, I really worked hard, and I made sure that what I did was going to be as good as I can possibly be. And so some of my teachers in my internship was Dr. Tom Tabor, who had a part of the residency program in the private practice program. And he and Dr. Warren Colton and Dr. Tim Lewis were the three that started the Phoenix Orthopedic residency program. Mm. So I guess I was lucky somehow. One or two of the people that liked me, especially Dr. Colton and Dr. Tabor, convinced Dr. Lewis that, hey, this is the guy that you want in your orthopedic program. So actually, I shouldn't say that. I got in without an interview. I was just saying, they will make a place for you if you want to come. But I was scheduled to go to Vietnam, and I said, well, I have it kind of middle of the draft program. So I thought the chance of me going to Vietnam is pretty high. So I decided to join the Ensign 1915 program, which put me as a sailor. So if I went in as a sailor, I would be back at Bethesda or San Diego or Oakland, so I wouldn't have to be out in the jungles of Vietnam. Mm. So I was thinking ahead.
Crazy.
So it worked out that way.
So when did you? So obviously that's early 1970s. When did you? When did you finish your training, and when did you start your practicing?
I finished my training in 1975.
Wow.
And it was delayed 6 months because they had to make a place for me. And so I had to work and moonlight for 6 months, working for the doctors to do their locum tenens, things like that. So I got pretty good in general surgery and in emergency medicine, things like that. I had 6 months of extra training where I was actually moonlighting. And then it was time for me to go in. I went in the end of 75 and was drafted to go to the Philippines. And that was probably when it really opened up where I saw the benefit of what I did. So I was the first one to do spine surgery in the Philippines as an American naval officer. Nobody else did that. They had to, people with back problems had to be medevaced to Germany or the US. So when I started doing that, luckily, my commanding officer was also an orthopedist. So they kicked out a full bird colonel to put me in because I was essential personnel.
Wow.
And at that time, I did trauma, I did arthroscopy, I did spine, I did children's because I spent my last year at Crippled Children's Hospital under Warren Colton. So it was fortunate that the war ended. So I had two other people on the Berry program, the last of them. And so we had three of us. Since I was chief, I got to decide what I would do.
Mm-hmm.
So I did children's surgery, cerebral palsy. I worked on club feet. I made the base commander look good because they were doing things in the community. And then I also had it well because when we went to the Philippines, I was in high demand because of what I did. The first one to do spine surgery in the Philippines.
That's unbelievable. And so, obviously you're well known, one of the fathers of endoscopic spine surgery. How did that all start? Because you had a wide, obviously, you took care of a wide variety of conditions. How did endoscopic spine surgery
that
start?
doesn't start with me because can you imagine? I'm telling people I'm the father of endoscopic. Who gave me the title was all the students that I taught. And most of them were Asian because they respected the people, their teachers. The United States, they sort of took it as, what's he doing? If I don't do it, it must not be any good. So when I first made the newspaper with this guy that I operate on, and I said I use the endoscope and laser to operate him awake, the chairman of Mayo Clinic at that time in Scottsdale said, you can't do what you say you do because I do endoscopic spine. And so I said, I'm going to let it go. I want you to visit me. And if you still think that, then this is a free country. You can give your opinion. Another one was Dr. Steve Stein, who was in the orthopedic program. And he couldn't do what I did, but he came out against me because he was the head of state compensation fund. So ended up, I don't know, I think I can tell you this because that's the truth. I sued him and I collected 6 figures from him, and he was insured by USA, and they just said, look, just don't try to give us trouble. So I said, okay, I'll take it. And then I hired people who knew what I did. One was McFarland. She was one of the best. She used to work for State Comp Fund, and she's the one that helped me negotiate a fee where I got 20% less than what they paid spine surgeons in hospitals, but I had 90-something% success rate. Mm-hmm. So for 20 years, I was in network with Blue Cross Blue Shield until the executives then decided, okay, they have new executives. It started with Bob Bola and Clarence Tang, and then the next one, his name escapes me. I operate on their family, and so they did pretty well for me, put me in network. Mm. But now, because of all the politics, I mean, if you're Democrat, you're Republican, you only get say one thing, right? You're either on the far left or the far right. Everybody in the middle, both sides reject them, but in reality, you got to be in the middle.
Yeah. So, but when was that first endoscopic procedure? When did you say, okay, I'm going to use an endoscope to do this?
1991. I took a course from Parvis Camden, and he did about 600, and he had all the big shots, neurosurgeons, orthopedic surgeon visit him, but he got into trouble because some big name was visiting him, and he had this lady was way overweight, and she was squirming, so he told his resident, put her under to do it, and then she ended up with a deficit. But see, at that time, he didn't know about all the pitfalls of endoscopic, because he would stay inside the disc. As soon as he tried to go outside, he got in trouble. And initially, I would get in trouble, but because I only operate on the patient awake, I started with 11,000. I have total 11,000 cases. But as soon as I had a complication, I said, I looked back at my images, and I said, what did I miss? So I missed anomalous anatomy, normal variations of anatomy in the foramen, nerves in the foramen, nerves inside the disc. So picking up Camden's technique, stay inside the disc, I developed the YES procedure, which is the inside out technique. But in reality, you shouldn't be just inside out or outside in. It should be a combination of everything. And you should be able to operate on your patient awake. That will keep you from getting into trouble, because the patient will tell you, if you can't do it without the patient hurting, then you're not good enough. Mm-hmm. So it's like, the all-stars. Who's better? Stephen Curry, LeBron James? Well, LeBron James, big, talented. Stephen Curry's a little guy, but he can shoot, right? Yeah. And so it's like professional sports. You recognize the people who have excelled way above their peers. And you can't do it for everybody, but you can teach what you know to those who want to learn.
And so, you've had numerous surgeons visit and learn from you. You've had, your Chris, your son, other physicians at DISC learn endoscopic spine from you, and you've been doing it for so many years. And still to today, it's not widely utilized by the spine surgery community in the United States. And I see a lot of spine surgeons wanting to start incorporating endoscopic spine into their practice, and that's the quote unquote future of spine surgery, even though you've been doing it for so long. So I guess my question is, for a spine surgeon looking to get trained on endoscopic spine surgery, what advice do you have for them?
This is a very difficult question to answer, because it depends on your dedication, and you're wanting to not just stick with what you learn in fellowship or in residency, that you're able to broaden your vision, but at the same time, to get good at it and not get into trouble, you need to do it with your patient awake. Very few people are going to do it awake, especially if they're learning on their own. They're much more comfortable putting the patient to sleep and having a mentor or somebody next to them teach them how to do that. But I would not be very good at that, because I would say, okay, you did did it well, but do it faster, better, and keep working at it. It's impossible to do that because of the liability, the lawyers. Mm-hmm. And most people don't know that I was president of Maricopa County Medical Society, and that time I decided I had an agenda. I wanted to make sure that the people who are in specialties knew what they were doing. But it never got to that level, because in order for them to learn what I do well, they probably have to have either me showing them how, or they have to be able to put their patient asleep. So once they're asleep, then they have their mentor tell them what to do. but whoever's teaching them has to be so good that they enjoy teaching. And that's how it can be done. But if you have to do it with the patient awake, the only people who are able to maybe handle that are the Asians, because we have over 5,000 years of history. We have alternative medicine, we have herbs, we have acupuncture. But even if we could do that with anesthesia, it takes 20 minutes to get them ready so that they can withstand the pain. But we don't have 20 minutes. We want to be able to hit them with propofol, knock them out. I call stun and gun. So you put them out, you numb them up, and they wake up 1 minute later, and then you can proceed. So the ophthalmologists learned how to do that. They do cataracts and everything. Everything's awake. And they're doing it. The ophthalmologists are surgeons, but now we have pain management who wants to be surgeons, and they're getting pushback from the spine societies, even North American Spine, which is a multidisciplinary program that's made up of surgeons, non-surgeons, physiatrists. But Dr. Doring, who's now from Arizona, who's the head from Yale, he just came out with a statement as president of North American Spine that we feel only adequately trained spine surgeons should be doing fusions. Now, I know Steve Kutchlich, he was my personal friend, and you are trying to sell his product. He's going to have to say those who are adequately trained and can do it safely should be able to do it. So it's not like, only surgeons or only non-surgeons. You have to be well trained. So how do you reconcile the difference in thinking between Putin and Biden or Trump, right?
Yeah.
They're
I don't know if you do.
all apart. They don't. And really, if you're in the middle, you're okay. But both sides don't want anybody in the middle. They want one side or the other. And it's all about power.
Yeah. I'd like to start getting into some more of the technical aspects of endoscopic spine. But just looking at, you mentioned, the Asian culture and the rich history of medicine, and I know for sure in Korea and China and in these Asian countries, endoscopic spine is really the standard of care, whereas here in the United States, it's not. What drives that?
I wouldn't call it a standard. There's so many standards. There's a standard speaking English, but everybody believes if you want to get ahead, you better learn English. If you learn Chinese, a lot harder. Yeah. Right?
Or more widely used, I should say.
Well, widely used because of the culture and what they accept. The Asians accept what we call naturopathic medicine. They believe in herbs and they believe in acupuncture. They believe in doing things, even though it doesn't cure you. If it makes you better for a year, okay, they'll accept that. They'll come back. But the U.S. mentality, you got to cure the condition. You're going to die one of these days. But if you have pain, and I know where the pain is coming from, then I can guarantee it because I will do it while you're awake. And there will be some people who can't stand putting a needle to prick their skin. They go crazy. I said, you're not a good candidate. So you have to be self-selected. It takes time. It took me 50 years to actually 30 years after I started. So I went 20 years as a general orthopedist in 1960s when we were all against Medicare, but that gave me my start because all I had to do was get the results. And I don't know if we ever make a standard, but the standard is going to be you should be able to do it and let your patient know what the risks are and be honest about your own skills. Okay, and not everybody can be a superstar, but that's where we start.
So before getting into the technical aspects of endoscopic spine, one thing I want to talk about is outpatient spine surgery. That's really growing a lot. And again, I think you started Squaw Peak Surgical Facility in the early 90s?
Late 90s, 1998.
98.
Here's how we started. I was at St. Luke's Hospital. Actually, I was at Crippled Children's, Good Sam, and St. Joe's. Then I eventually went to St. Luke's, where I became very good friends with Mary Starman Harrison. And she was trying to promote me with Mary Jo West, on TV programs, and people said, what is he talking about? But then finally, when it looked like she was going to leave, I said, Mary, how much are you making off of the surgeries that I do through the hospital? She said about $7,000 to $10,000. And at that time I was doing 30. I said, I can borrow and open my own surgery center and pay it back within the year with my volume, as long as I can get somebody who will take me up on my guarantee that you don't have to pay if you don't get better. I started out with 3.5% complication rate, and now I'm down to less than 1%, but it never goes to 0.
Mm-hmm.
But I get smarter in selecting my patient. So the bottom line, know what you're treating, treat the pain, do the outpatient procedure with the patient awake, which is much harder to get good at it. But once you get good at it, it's hard. Nobody can stop you.
Mm-hmm.
And I still have people that come to me and wanted to know what I think, because they heard about me, even though they may not do it. So just the other day, I had an ophthalmologist called me. Hey, remember me? We used to be at Osborne, and I was told that you're the best at what you do, but I know you're retired. What about this, and this? And it went to see one of my partners, says, well, you have a condition that needs a fusion, but we're good at it. And so you can get it all done in one step and not have to deal with it in stages. Like I would say stage, when I operate, I'll get you better for X number of years, but if you don't get better, you may need more.
Mm-hmm.
Okay. It's like buying a car and expecting it to last forever.
Yeah.
It doesn't always, if you get in an accident, then it's devalue, right? So it's hard to get to that, but then it's possible. And I think in the Far East, they're going to overtake the West because they have different attitude.
Yeah. So looking at endoscopic spine surgery, there's a handful of manufacturers out there, right? You developed the YES system, which is a Wolf platform now,
Yes.
right? There's Eloquence, Joymax, and others. As a spine surgeon, or maybe even as a facility looking to get into endoscopic spine, how would you navigate what manufacturer to partner with?
Well, even for manufacturers, whether it's in China and Europe, follow the money. Everybody wants to get in and make their money in a short period of time and then go with it. Now it's finding something that is worthwhile, form an IPO, have people hyped up and want to invest in it. You get the funding, but everything is not going to be long term. So you understand it as a businessman, as somebody who looks for products that you can sell, you follow the money. And it's never going to last forever. For people, if you treat people and treat your pain, you can get them better, but they're going to die one of these days. They might live to 110, but they're still going to die. There's no fountain of youth. So it's a matter of having a platform that makes sense. For instance, right now, if you were listening to the entrepreneurs, Goldman Sachs and the big firms, they say, if you go with us, we will guarantee you an average of 15% return. Well, if you have 15% return, you double your money in about 4 or 5 years, right?
Mm-hmm.
So that's the what do you call that? The platform.
Mm-hmm.
So now I attend these seminars of people who are hyping, okay, invest with us because we will buy private companies that are not worth as much as we think we can make it. But with our information technology, we know how to get data and give you feedback, tell you how you're doing compared to your peers. And that information is called, I guess you can call it information highway with technology, AI.
Mm-hmm.
Okay, but everybody's promoting 5G. I think China has 6G, And the way you do it, if you have a product, you can take a picture and send it to the network, and they say, oh, this product came from this place, here's what it costs to make, here's what you can buy it for. That's information.
Just like that, yeah.
Right? But at the end, it has to benefit the person who markets it.
Yeah. One thing, I had a company VP from Immertech. I don't know if you've heard of them.
There's so many now.
But so your surgery center, you were, if not the first, certainly one of the first. In your OR, you have cameras that stream over the internet, and you taught
Yes.
via that method, which is really cool. And this company Immertech, so it's immersive technology. So I don't know if you've ever played around with VR, where you put the VR goggles on, but they can basically, if somebody wanted to come into Dr. Yeung's OR and they're living in, say, Florida, they could put on these VR glasses, be right there in the OR communicating with you. So just talking about shortening that learning curve and knowledge, right?
Well, Stryker is one company. They're all the big companies want to jump in, right? So I was working with a company called Mobius, and they were into AI. So I was the guy who I worked with Hanson Yuan. I said, hey, I can help you with image recognition, 6G type, where I can look at you and I can tell you, don't touch that. That's a nerve. This is, this causes pain. This is maybe a nerve, but you can get around that because they have pain because of inflammation. And it all starts in the disc, whether it's cervical, thoracic, or lumbar. If you focus it on the disc, then you can expand from there. But not everybody can shoot a basketball like Stephen Curry. Not everybody can dunk the ball like LeBron James. You have to work as a team, and you have to know who's going to be good at what.
Yeah.
Now, I always come back to sports because basically in sports you compete against each other. And no time is somebody going to dominate forever.
Right.
Look at the Suns and the Cardinals, right? Somebody's going to figure out what they can do to counter. So it's ever changing.
Yeah. It's a meritocracy, right?
Exactly.
You have to keep keep ahead of
But
the
only
game.
a certain number of people can reach the pinnacle. But not everybody has to be number one. You have to be above average. I'm using Military Academy, Virginia Military Institute. They didn't want women, but finally they decided. Ruth Bader Ginsburg was the one that says, hey, you got to have equality. If a woman can do everything a man can do, they can belong in the academy. Right? And look what's happened.
Yeah.
You have women in West Point, in the Naval Academy, Air Force Academy.
Yeah. No, it's great. And so, like I said, just talking about some of the technical aspects of endoscopic spine. I have an endoscope and a model here. Can you maybe point out on the model and maybe with the scope some of the things to look out for, some of the pitfalls? I mean, I remember the first time I heard the term vertical nerve was from you. So can you kind of just walk through some of your thoughts on that?
Okay. The first thing to know, one of the pearls, the anatomy does not change. Visualization of the anatomy will change depending on the equipment you have. Okay. So I don't know if I have something to point at, but if we can focus in on the spine, the technique that I learned, inside out technique, was to come in the foramen, where you come in beneath the facet joint right here. And you have a little tube with a little retractor. And once you get into here, you can rotate it. So you can look at the nerve, you can look at the epidural space, you can look at the disc, and you're right in this region, which you can identify the differences in people's anatomy. So I focus on the cause of pain. And the cause of pain is best identified with a image, or the JPEG, MPEG, but the best way is a video. The video, then you can move it around, you can actually see where you went. So imaging is important. The system of the endoscope. This is not my design, but this is a simpler design than mine. Mine is, I had it for 20 years, and finally Wolf signed off. They were paying me royalties for 20 years. Then they gave me a gold-plated endoscope with my name on it.
That's
and
cool.
Then they say, well, it's time to move on. And I was helping at the same time Eloquence, who was focused on inside out. And so the Eloquence scope is similar to this, except the working channel is much bigger, so you can put in burrs and cutting equipment. Whereas the scope that I had, it was limited to a 2.8 millimeters. But this is like 4.2. Now I can put big instruments down here. And we can simplify the design by having it, you can rotate. But mine stick out this way because I wanted the assistant to be able to put everything in. So mine was awkward, but it was one that people just didn't understand it. But I had 20 years on it, so nothing lasts forever, right?
Mm-hmm.
So the new scopes are like this. They're made by Joy Max, Endius, Spine DOS, some other German name, but the best technology still comes from Germany.
Mm-hmm.
So they make it. So the people that used to work for Wolf or Joy Max, they branch off on their own and they'll form OEM companies. Okay, the OEM, they make generic brands.
Right.
It's like, if you talk about fashion, where did fashion come from? Spain. These were people that were rich enough, they only had one dress made, and the people from Spain went to South America and they went to Venezuela. And so all the real beauties are in South America, but after a while, you can look at them and it's great for the first 5 years, but after you've been married 5 years, it doesn't matter as much anymore. So I joke with my Venezuelan surgeons who had beautiful, gorgeous knockout beauties. But after 5 years, who they marry are people that are more compatible with them.
So you touched on it earlier, and it's definitely a controversial topic right now: spine surgery and interventional pain management. We all know what spine surgeons do, and we all know what interventional pain management physicians did: injections, RFAs, kyphoplasty, medial branch blocks. But now there's interventional pain management physicians doing posterior lateral fusions, like interspinous fusions, SI joint fusions. They're doing endoscopic decompressions. Given your experience and kind of looking towards the future, how do you see that playing out?
It depends on the individual. You can't say this is my area. I think in the future is going to be whoever can do it and guarantee the result. I started guaranteeing my results about 6-7 years ago. So when people say, well, I only want to do what insurance pays, I said, that's fine, I'll take it. But you might have to wait 6 months because I'm too busy. I'll work you in if I have time on my schedule and I want to take you on. And so the people who are going to say, it doesn't matter, I'll pay you what you want if you guarantee it. So I stayed busy for 30 years just with that mantra. And I end up maybe getting people like you who can afford it. And they say, I'm disabled or I'm not disabled, but I want to have less pain so I can work harder. And I said, Mike, you pay me X number of dollars beyond what your insurance pays. I'll guarantee it. If you don't get better, you get it back. But I'm going to have to tell you, you can't just say you're not better. I'm going to prove that you're better. Mm-hmm. So afterwards, I will see how you're doing. Oh yeah, I'm doing great. And I say, okay, that means I've reached that. But I don't know how long it's going to last. But on the average, what I do for you will last 5 years to 7 years. So then it becomes a scaled down warranty. First, you get all your money back if you don't get better. If you need more in 3 years, I'll give you half your money back. And if you last 5-7 years, it's done. The warranty is over. Mm. So I call that a warranty.
Yeah. No, I mean, it's interesting because, in the United States, it's a lot of it's fee for service, yeah, they talk about, value-based
Right.
care, and I still don't know if that is really even happening, or it certainly isn't happening widespread. And there's very few arrangements like you were just mentioning, where you guarantee the outcome, you know.
Well, it's few, but I was lucky I got a head start on everybody,
Yeah.
like back in 1970 when I got my residency. But in the end, there are companies that do that. For instance, Genesis, they take the most sought after innovations from all the big automakers, Audi, Mercedes, BMW, and they put it all together in their Genesis so they can sell it for half the price because they didn't have to do all the research to get it there, right?
Mm-hmm.
And so for value. But then if you are, for instance, like my wife, I wouldn't be caught dead with a Genesis. I have to have Saks or Neiman Marcus or Gucci or something like that.
Right.
Then there's those that like that for fashion or for art. So let's say a piece of art. How do you put value on it? It's only what it's worth to you,
Right.
right? And if you keep it and you look at it and you still enjoy it, fine. But if you've gotten enough out of it, you can donate it to a museum, get a write-off, or you can sell it to somebody who will enjoy it more because you're at a point where you've had it for all this time.
So one thing I'm thinking of is, obviously you've had a lot of accomplishments throughout your career, but what are some things that stand out the most? Like, what is, out of everything you're able to accomplish, what's something you're most proud of?
I think I'm most proud of the fact that my son is very successful, maybe more successful than me. My daughter, she says she likes dermatology, but she likes children. So I think it's easier to be a pediatrician. I said, don't you dare. You work hard. You become a dermatologist. So she worked, she did research, and she's really good at it. And all my grandkids, fortunately, I tell them, none of you are going to be trust fund babies, but you get health care, you get education. After that, if you get anything, I can match what you produce on your own, but you don't get to take what I generated so that you can be a trust fund baby. I said, that won't work.
Mm-mm.
So it's all about working hard. I can tell you, I'm not the smartest, but it's hard to outwork me. But look what I had to give up,
I love it. And then, looking towards, it's 2022. What is spine surgery going to look like 10 years from now? There's robotics, there's obviously endoscopic spine, which you've been doing for a long time. What's it going to look like?
I think I can't predict that because if you watch Star Wars, you may be able to scan somebody. Oh, here's the problem. Let's do this, do that. You don't need surgery. I can change the bottom line denominator. What do you want? Less pain, less neuropathy, less numbness. But the longer you live, the more problems come up. So now I have type 2 diabetes. I have peripheral neuropathy. Is it caused by my not controlling my sugar? Probably not. Is it caused by inflammation of the blood vessels that innervate the organs, the kidneys, the brain, the heart, the lungs? Maybe. So that's still unknown. And I don't know if you can ever live forever, because I don't think you can.
Yeah.
But your quality of life will be extended to probably at least 90. Okay, but now you can't help dementia, you can't help Alzheimer's. But eventually things wear out. It can't last forever. If it does, we'd have to fly to Mars or someplace else, and there's not enough room in the earth to feed everybody.
Yeah. My profession, medical device representative, really, my job is to support physicians and when you really simplify it, provide them with solutions that help them in the operating room and outside of the operating room. In your experience with medical device reps, what do the good reps offer, and what do the maybe below average reps do that make them below average?
Yeah. Well, I'll consider you as a good rep, okay? Because you look at technology, the fact that you're supporting Optimish, which I supported from the very beginning, back in the early 2000s. But it was easy to do, but the doctors that want to learn and do a good job, they get persecuted because they're not surgeons.
Mm-hmm.
And that attitude is still around. I follow North American Spine, AAOS, International Spine Surgery, and then I have my own organization called International Interdiscal Therapy, which I took over from Eugene Nordby. It started with camopapine, okay, but nobody uses camopapine anymore. But it was a great drug. First manufactured by Boots Pharmaceutical, taken over by Knoll. But they weren't making enough money on it because if you have somebody using it, they get a complication. The lawyers come and take out all your profit. So you may have to change the legal system so that the lawyers can't just sue everybody that gets an unknown result because of science,
Mm-hmm.
and they take advantage of it. You know, you see this all the time. Sign up with us, you don't get anything, you don't get paid, but you might have substantial award, and then they figure how the court cases rule, you know, for companies, even like OxyContin, and I used to prescribe that because I said, okay, if I give you that pill, you take one pill and it's okay. But now I don't want to because a lot of people are getting opioid dependence, and now they have a more powerful drug,
Mm-hmm.
fentanyl. Okay, but we are a pill culture. We're a fast food culture. You know, fentanyl now, the pill that's taken by students, Adderall, that's amphetamine. That's just a different name for amphetamine.
Mm-hmm.
But now they have Adderall. Oh, you have, deficit problems. Then you take it and you're all sharp. So it makes you focus more. You don't have as much deficit, but it's a drug.
Yeah. Yeah, it's wild. I haven't watched it yet, but there's a new movie, or maybe it's a series, Dope Sick. Have you heard of that?
No.
It's about
About taking pills.
Yeah, it's about Purdue
Yeah.
Pharma
Yeah.
and narcotics and kind of the promotion of Oxy and all
But
that.
look at right now. I kind of laugh. I love vegetables. I'm Chinese. If I had my choice, I would have vegetables, all the green vegetables, but now you take Balance of Nature. Instead of taking your vegetables, you pop a pill for $1 a day or whatever,
Mm-hmm.
and they say, "Oh, I got my Balance of Nature," but that's the pill culture, right?
So how do you reverse that culture? I mean, that's
I
such a
think
big
you
shift
can't
to
reverse.
turn.
You can't reverse people's thinking. So each person got to think differently. I wouldn't take that because I wouldn't pay to take a pill for broccoli and Brussels sprouts, things like that, because I love it. So why do I have to pay so I don't taste it and take a pill? But it has to do with what you like. And so everybody's different.
Mm-hmm.
Not everybody's going to like steak and potatoes. Some like vegetables, some like Mexican food, some like Thai food. And now you see, even on your papers, it's all about, hey, get your own chef and eat these high-end foods, but you have to like it.
Yeah.
Right?
Yeah. Well, I really appreciate your time. I've really enjoyed this discussion. I wish we had more time. We'll have to get you on. We'll have to get Chris in here, and I'll have to talk with both of you guys. And
I would be interested to see what Chris thinks, because he doesn't think like me, but he's more traditional. He's much better liked than me because I have no filter. I'll get on your face right away.
Yeah, in my opinion, we need more people like you with no filter. It's people don't like to hear the truth. But they need to hear it. So, anyways, Dr. Yeung, really appreciate you coming down here. Just really appreciate everything you've done for the spine surgery space and all the patients and physicians out there that have, that you've taught. So it's been a pleasure speaking with you today.
Well, it's been more a pleasure for me because you give me a forum to mouth off without having to worry about having a filter.
Thank you.
You're welcome.